Donnie Taylor suffered from chronic obstructive pulmonary disease and lung cancer. He was in palliative care in Truro. He knew he was dying. He just wanted a peaceful end. His family alleges he went 13 hours without enough oxygen after he was returned to his hospital room following a family gathering down the hall. He died the next day.
They called me and said, you should come in. He sounds more congested. And I'm like, oh my God, yeah, we're coming right in, da da da. And what they were doing was assuming that his apnea, they call it an apnea, I guess, when you're stages of dying. And they were assuming that he was going faster and that he was getting more congested. They didn't think at the time that it was a lack of oxygen, that he was struggling, that he was trying to breathe and couldn't speak. To see him struggling was different than just being sick. He was gasping. He was trying to express his feelings with his face and that, trying to tell somebody to help me. A lot different than apnea. A lot different than being congested. And when I come in the morning, I expect him to be congested. Oh my God, when I come in the morning, I was like, it was shocking. It was literally shocking. It was like, oh my God, what the hell is going on? He was reaching, he was looking at us, he was pulling at the bedclothes, he was going from one person to the other looking, and they called that apnea. Oh my God. It was obvious. We don't know anything about apnea, none of us, and we were like, oh my God, what's wrong with him? What's he trying? He's trying to tell us something. I was like, he's trying to tell us something. What is he trying to tell us? That's what we were like all morning. In their notes, it's like, nope, zero stress all night long, zero stress, little congestion. We gave him his meds, zero stress. He was like that the whole damn time. And I believe it worked out to be something like 13 hours. We were in the room ourselves with him from like 6:30 or so in the morning till almost 9 o'clock before none of us could. Tracy's standing there next to him by the bed, and she's like, "Where's the noise? There's no noise." She said, "What about his oxygen?" And it was like, holy God! We all just looked at the wall at the same time. It's like, oh my God, oxygen! They run out to the desk to get somebody to come in. She came in and looked at the wall, and turned it up. Turned it up to 5 liters, which is what he was supposed to be on, and just kind of run through and said, yep, he's okay. He's okay. I mean, how wrong is that? How wrong is that? He's okay, and started to leave the room till Tracy freaked out on her and said, wait a minute, back up here, What do you mean he's okay? He had no oxygen. That may have been a chaotic error, maybe. It's possible, things like that can happen. But now you've got 13 hours of 4 people looking after a patient in palliative care that literally did not recognize the fact that he didn't have oxygen. How do you do that? How do you be a palliative care doctor, nurse, whatever, and not recognize that a patient is not just in decline, not just having apnea, not just having congestion, but there's something else going on here? My God, help us all. We're in trouble.
The Nova Scotia Health Authority would not comment on this case because the review it conducted is confidential. But documents obtained by CBC News show Donnie Taylor's death did lead to some changes at the hospital. As a result of the review into Taylor's death, hospital staff were ordered to review documentation practices related to checking oxygen administration levels throughout each shift and provide intentional education regarding the role of oxygen on the palliative care unit. A review was also done by the Department of Health. It determined there wasn't enough evidence to confirm the alleged lack of oxygen amounted to neglect. Amy.